Hello, welcome to Doctor Talks. This is your host Vivek. Here we chat with the best doctors about diseases and conditions they treat. This episode of Doctor Talks is different. Today, we will not discuss a specific disease or health condition, but we would talk about how one can stay healthy during COVID 19 by adjusting our eating habits. Good nutrition will boost our immune system, thus, either preventing infection or helping during recovery. To quote Hippocrates, let food be thy medicine. Thy medicine shall be thy food. Our special guest today is Miss Ujjwala Baxi, a registered dietitian and diabetes educator. She has helped several individuals around the globe to achieve optimum health and weight, look younger, feel better, and transform their lives through balanced diet and lifestyle management with long lasting results. She has also healed individuals with varied health complications such as diabetes, renal disorders, cancer, hormonal disorders, etc., in hospitals and her clinic. Her exceptional work has been well recognized and published in Straits Times, Ali Singapore, and Philips Home Living, to name a few. Welcome, Ujjwala.
Thank you, Vivek. It's my pleasure to be on Doctor Talks.
We know healthy eating is important, but why do you think it's even more important in current scenario of COVID-19 pandemic?
Now, in the current scenario, our diets in general have gone for a toss. Now, that would be due to lack of labor, increased stress levels. Unhealthy diets are contributing factor to pre-existing conditions that have actually got us more at risk of various health problems. Okay. Now, emerging evidence suggests that diet related conditions such as obesity, heart diseases, diabetes, they are suffering consequences from COVID-19, which is leading to more severe illnesses and use of respirators. So generally, we do see that patients get scared of the concept of respirators and they don't want to use it. But the way we are eating in COVID-19 with respect to the lockdown, trying to beat the stress with delectable food at home, it is all actually contributing further to the illnesses, specifically in people who are already having some kind of pre-existing health problems such as diabetes, they have heart problems. So if they end up splurging on calories, they are going to see the massive health hazards that will follow after such kind of faulty eating habits. Now, according to a poll by WebMD, almost 47% of women have actually shown that they have gained weight during the lockdown than the 22% which is found in men. And 60% of these volunteers suggested that their stress levels actually increased. We all are experiencing it. And a sedentary lifestyle was a contributing factor. There were 21% of these volunteers which blamed the extreme alcohol consumption during this lockdown, which they were using it as a soother for their increased stress levels. So, COVID-19 is not only impacting our health physically but also mentally, because the type of fears that we have nowadays, which are different fears altogether: fear of catching virus, worrying about the family, social isolation, financial pressure, rumors everywhere, and information overload. So, these couple the effect of obesity by adding to stress and anxiety levels, and which leads to higher intake of and lower diet quality. Now, the stress that comes due to physical habits and due to mental habits that are coming up, they have actually shown an increased release of cortisol, which stimulates the eating habit on its own. So, the stress that comes because of the lockdown is actually leading to increased release of cortisol, and stimulates on its own the decreased brain sensitivity to leptin potentiating award pathway. Therefore, if people, we can actually observe this, that people have a greater tendency now to consume heavy foods. We were not consuming such high calorie dense foods earlier before the pandemic, actually arrived, than what we are seeking forward to. We wish to, every now and then I'm getting from my clients that I am not able to understand why the need of or the urge of eating highly palatable food is coming in. But this is how our brain is functioning right now. We don't have anything else to debunk our stress. So we are looking forward to food as a relaxing uh, mode. So that's the reason why the increased demand of highly palatable food is coming up. The salt, sugar, and fat intake goes high in our diet, and altogether the healthy eating is gone completely out of the window in certain cases. That's why, as you asked, why healthy eating is important. This is the main reason why it is important, specifically in this current situation of the COVID-19.
Now, that's very interesting. What I understood you mean is that because of the associated stress related to COVID-19 pandemic and lockdowns, it's triggering certain hormones in our body, which is causing us to eat more to relax that stress, right?
Right, correct. And we then feel like eating more of salt, sugar, fatty foods, highly palatable food, which is tipping up the weight chart.
Now, in this scenario, what would be your advice about healthy eating during COVID 19?
Okay, so I feel that the answer to this lies in three keywords: awareness, introspect, and correct. So, very importantly, first and foremost, we need to be aware of our current health status. Okay, in keeping in mind the perspective of our previous health status before the pandemic. And when we are aware of what we are at now, like looking at the weighing scale, we get to know the weight, just the way the clothes are fitting us, we can evaluate whether we have gone a little higher in inches or the size. Okay, the waistline itself can determine whether we have gained weight if we are not really going by measurements. And for people with diabetes, definitely they have to check their blood sugars. For people with heart problems, they can go for 3 monthly blood cholesterol test. So these are the basic parameters which can bring one to awareness of their current health status in view of what was it before the lockdown. So once we are aware of where we are right now and we know that it's not something welcoming, then we need to introspect and figure out the root cause. For instance, do we see that there definitely has there been an increase in the calorie dense food intake? Definitely activity has reduced. For people who drink alcohol, are they gone high on the alcohol intake? So if these are the few pointers that clicks through, then one needs to take corrective measures. And if once the person is not able to evaluate, they just don't know what is going wrong, why are they not able to understand what is actually affecting their weight, then they might need to reach out for a healthcare professional to evaluate what was the previous diet and lifestyle, what were they doing before that they are not doing now, how the diet has changed over the span of last 3 4 months, and how what are the corrective measures that they can take in order to go back at least to the previous health, which was definitely it should be fitter than what they are today. So it's not that everyone is falling off the chart of weight. There are few people who have pulled themselves up right from the time of lockdown. They got it that their physical activity will be reduced, their diet will suffer, and they have introspected, corrected their lifestyle and diet right in the beginning. This is for those who have been not really able to figure out what is going wrong and their weight is just going higher. So first thing first, we need to avoid fat diets. So when we talk about corrective measures, then what happens is people all of a sudden feel very anxious. Oh, I've gained so much of weight, I can see that I'm bloating, my the dresses are not fitting me. So the corrective measures that they tend to take are very extreme. They start landing up into fad diets. They pull up something that they've read on the internet, or they just came across a friend who is following some kind of a diet, and they want to implement them, those kind of rigorous or extreme measures on themselves, which is going to actually worsen the condition. Because if it is not meant for you, and it's not customized for you, then might as well go for something which is doable. So the two key things that a person can look in for some kind of health regimen that they want to use as a corrective measure is sustainability. They need to look into the diet and lifestyle which is more sustainable. Okay, and the second one is should not be a fat diet, very importantly, because fat diets ask you to eliminate certain food groups, like just eliminate carbohydrates, and you will be actually doing a keto friendly diet, going very high on the fats. So these kind of diets can work temporarily, but they are not sustainable. And when the person wants to bring some variety into their diets, that's when then they actually fall harshly on these diets. So my advice would be, when one wants to correct themselves, the idea is to be very sustainable. Okay, hydrating oneself as much as possible. So definitely in the lockdown we are at home 24/7, and food is available 24/7. We are going so definitely we need to make sure that the food that is like snacks, okay, we need to keep them in cupboards and in containers which are not transparent. Because if we keep them in transparent containers, the more we see them, the more we feel like eating them or nibbling them, even if we are not hungry. So out of sight, out of mind, that is the strategy that we need to use here when we are at home and we want to take charge of our health. So if you're not hungry, simply just keep the unnecessary food, that is some anything which is beyond the breakfast, lunch, and dinner consumption, just keep them out of sight, and only reach out to them as a source of meeting your energy needs in crisis. Like when you're very hungry, it is going to take some time for the meal to be prepared, then reach out for a snack. And stock on healthy snacks, this is also one more thing. So whatever you stock is going to be eaten. So if you stock unhealthy snacks, fried snacks, that is what you're going to land up when you're hungry. But if you stock on something which is healthy, like makanas or simply sukha bhel, kurbura chana at home, you, even if you're hungry, you feel like snacking, you can snack on them guilt free without taking a toll on your health. The another thing that you can do is swap the grains. That is also very simple. If you're used to eating white rice generally, swap it with the brown rice. But if you feel you can't really take the brown rice, you've not eaten it any time, as simple as just moving to broken wheat or dalia can help. Okay, increase the fruits and vegetables. There have been researchers which have proven that just increasing the amount of fiber in the diet, like 66 grams of fiber in the diet, which if I were to just give you in lay terms, about one and a half apple, okay, or about 2 to 3 carrots or 2 cucumbers. So if we eat at least this much amount of fiber, or add on to this much amount of fiber in a daily diet, we are going to actually prevent ourselves from going higher on the weight, as well as on the blood sugars if the person is suffering with diabetes. So that is one simple measure that one can do. Intermittent fasting definitely can help when one is in lockdown phase at home, because again, intermittent fasting is going to advise you to eat, not eat for long hours and then eat. But definitely we won't suggest you to follow intermittent fasting for 6 or 8 hours at a stretch during the daytime, which can make a person sick. And they can experience acidity, or and rather than helping oneself, they would rather hurt themselves. So anything which is doable, like if you are used to eating every 2 to 3 hourly, instead of that, just try to extend the time gap between your breakfast and lunch to 4 hour. Okay, of if you're used to just eating very late dinners, try to do it, prepone it by 1 hour. So try to extend things by 1 hour, or prepone or postpone by 1 hour. So if you use doing breakfast at 9 and eating lunch at 12, you would rather choose to eat lunch at 1 p.m. And if you're used to doing dinners at 8 p.m., rather you try to prepone it by 7 p.m. So just a 1 hour difference is going to help you in controlling your blood sugars, in controlling the weight, in controlling your appetite. So this really helps beautifully, specifically in this lockdown, to take charge on the weight. So disciplining oneself is the key for healthy eating in the COVID-19.
Sure, and that's a very right advice. Now let's consider children who are no longer able to go to school and also not able to play outdoors with their friends and groups. Their screen time has gone up as they need some engagement while at home. What would be your advice to parents to manage the health of their children through healthy eating?
Okay, so for parents who are worried about their children's screen time and don't know how to control it, definitely telling them, nagging them that, okay, you can't watch television, you can't do this, you can't do that, kind of a screen is not going to help. It will just reinforce the child to watch it further and do it more. So the best idea is to come up with certain activities which involve the children with them, with the parents themselves. So if the child is interested in cooking, parents can plan for certain items, food items that are doable with a child in the kitchen, which is not too messy and it's easy to execute. But again, desserts which are healthy, not something which is rich in calories, because that is going to definitely affect one's the child's diet as well, and it is going to affect the entire health of the family. So in that case, I would suggest that, like for example, if the child wants to eat a dessert or an ice cream, the parents can look out for recipes which are fruit based rather than heavy on refined flour and cream. Okay, so a fruit based ice cream instead of heavy cream based malai kulfis or vanilla ice creams will be more helpful to whip up something together which is easy to do, can actually cut down on the screen time. So these simple measures can be really taken, in order to help the children get rid of excessive screen time as well.
What would be your advice for elderly parents at home in terms of their diet?
Okay, so by now we all know that elderly are highly prone to contracting the infection, right? So hence taking utmost measures to keep up with their immunity becomes crucial. Now, since most of the health issues arise from gut health, we know that we need to keep our digestive system in proper functioning. Since we know that elderly have a compromised digestive system, we need to ensure that they eat more balanced, and the need for eating more balanced really becomes essential at this time. Okay, so keeping gut health in check in order to keep up the immunity is very important for elderly, and this they may do by eating simple cooked homemade meals, which are less spicy, oily. Okay, they have a good balance of proteins. Again, when I say proteins, it should not be proteins which is difficult to digest, like meat proteins or proteins which are bean based. Okay, try to avoid these heavy proteins specifically for dinners, because those are the ones that can create bloating, acidity, and when they have that kind of a discomfort, eventually it is going to make them have sleepless nights. And that can also then further, so if the person is having diabetes, because of the erratic sleep pattern, because of the the gastroparesis, which is called as, that is slowed digestive health, digestive system, their blood sugars spike up. Okay, and this will eventually reflect in their overall health. Excessive blood sugars are going to lead into massive complications of diabetes. So micromanaging it right at the foundation level, wherein the person is simply eating cooked meals at home and not eating heavy meals for the dinner specifically, is going to prevent the elderly with gastric discomfort, and thereby preventing compromised immunity. Very importantly, they have to avoid refined foods as much as possible, which the chances of eating much more in lockdown are high, because those are the items which are very easily available nowadays at the grocery stores. Again, they are delectable to while away some time at home. Don't know what to do, just have a cup of tea with a couple of biscuits. So they might just look like just a couple of biscuits or just a couple of bread slices, but they can actually cause build up on the bloating and the acidity issues. Okay, so limitations on bakery products are very important. Addition of probiotic foods like yogurt, homemade fermented pickles, kanji can really help at this time, because they, apart from just adding to the probiotics quotient, they also help to build immunity. Okay, they are loaded with micronutrients. Okay, sprouted foods which are cooked. Okay, so sprouts, chila can be very helpful at this time, again because it is dense in B complex vitamins, it is dense in vitamin C. But very importantly, having said that, never have sprouts on which are uncooked or raw, because they are going to add on to the problem rather than help. So ensuring to eat right ingredients, but the right way of cooking procedures are also very essential when we talk about elderly health and nutrition. They need to make sure that their vitamin D and vitamin C supplementations are on in order to boost their immunity. And very importantly, elderly with pre-existing diseases need to have a tight control in this lockdown phase, specifically with respect to their blood sugars, blood pressure, cholesterol. As I mentioned earlier, because of the hormones and the imbalance due to the stress levels, there's already a need of excessive intake of sugar, salt, and fat. And in elderly, the taste buds are also compromised, due to which they tend to eat, ask for extra salt, ask for extra sugar, because they are not able to sense the taste of the food. So this together can actually spike up their blood sugars, can rampant their health. That's the reason why they need to be very careful in this phase, and just prepare simple meals rather than getting too much into elaborate cooking and heavy cooking.
Do you have any special advice for pregnant women?
So, as I'm seeing a lot of pregnant women in this pandemic, my advice to them is very important, that they need to ensure that their meals are healthy, well planned, and guided by a healthcare professional throughout their pregnancy term. So, there are pregnant women who would generally come and seek healthcare advice or a dietary advice when they are close to their oral glucose tolerance test, that is OGTT, which is done in the 24th to 28th week of pregnancy, because they are a little scared of their blood sugars, if their blood sugars would spike up high. But we need to make sure that instead of just treating their diets acutely, they need to make sure that the entire 9 months of pregnancy, specifically in this lockdown phase, needs to be taken care of, because excessive intake, no physical activity or reduced physical activity, because they are not allowed to step out. And of course, they are supposed to be more careful about their of preventing infection. So their chances of stepping out of the house are also less. So all this contributes to increased stress level and increased weight gain. Increased weight gain may lead to GDM, which is gestational diabetes. So even if they were to eat unhealthily in the first 3 4 months, and then they want to take it very acutely, they want to take care of their diet just before the test, it won't work. They have to take good care of their diet right from the beginning. Talk to the doctor, ask for advice. If the doctor is unable to help in detail, then reach out to a healthcare professional, get your diets evaluated, and make sure that you are eating a well balanced diet, as most of the meals have to be prepared at home. Ensure that the meals are not very heavy, and just about 9 to 11 kgs of weight gain in the entire term of pregnancy should be advisable. So, my advice would be a 3 monthly check on their diets and fitness can prevent with GDM or birth defects. Okay, so 3 monthly checks means the first trimester, the second trimester, and the third trimester. So, if the person is not able to seek advice, or had completely neglected their health with respect to diet in the first trimester, they can look out for some care in the second and the third.
Recently, we did a podcast about how to manage diabetes during COVID 19. Our guest, diabetologist, emphasized the importance of healthy eating. I want to take this opportunity to ask you what diet adjustments needs to be made by people having diabetes.
Okay, now people with diabetes need to be extra careful in lockdown as their chances of blood sugars going beyond the normal range is extremely greater due to the lack of physical activity, due to extremely high caloric intake, due to lack of fiber. When the lockdown just started, I had a few clients who were concerned about the availability of fruits and vegetables, and they were not too sure how to manage their blood sugars with a limited amount of availability of groceries. So the only simple way that they could do and that was advised to them was not get very choosy about the fruits and vegetables that are available. Just procure the ones that are available. Use them in your food, in the cooking. Okay, again, as mentioned earlier, don't go for raw foods. Eat as much as cooked foods in order to prevent any kind of infection. And very importantly, discipline is the main factor that will help any diabetes patient to take charge of his blood sugars. That is something that cannot be neglected. Like you can spill over on the calories or the food, neglect the diet but neglect the physical activity for a day or two. But especially in the lockdown, if it becomes a habit, as a lifestyle, because anyways the way we are living in the lockdown phase has become a complete new norm. So something which was never before. So some habits have been generated due to lockdown. So if the person feels that this is something new that I'm developing, some kind of cravings that I'm developing, if the person never had a sweet tooth, but because he is at home, because the family members are eating, they are making, and they are not able to compromise on their the cravings, because there is somebody who's having diabetes at home. So then the chances of the person also falling in the trap of eating sweet foods or delectable items goes higher. So it becomes a family support system as well. That is also essential when we want to take care of diabetes patients at home and prevent them from having high blood sugars due to higher food intake, higher caloric intake, and landing into major complications, because we've seen cases wherein they have gained weight, they have uncontrollable blood sugars, and then they are landing into complications which require ventilators. So the person with diabetes really need to take care with respect to their diet. Again, not very stringent, just small changes, increasing the fiber intake in the diet by about, if the person is lost the idea of eating fruits and vegetables, they are not eating enough, then just add one more fruit or one more vegetable, like in the form of a salad or a sprout salad, cooked one. Would be as simple as that to make that change and prevent the extreme high blood sugars. So intermittent fasting, as I mentioned earlier, coupling it up with some kind of discipline, that okay, this is my portion for breakfast. If I feel that I am eating more than what I was eating before the pandemic, then I need to come down to my portion, back to the portion. And if there is an urge to eat more, then just completely avoid the thoughts that are urging the person to eat more and indulge more in the item, how much ever it is fancy and sumptuous. So these self talk, these kind of self talk, self discipline is going to be very helpful when we have to make sure that the diabetes person takes control of his blood sugars during this pandemic at home.
Talking to you was really helpful. I believe all our listeners would benefit immensely by adopting your advice to eat healthy during COVID 19. Thank you for speaking to us.
Thank you, Vivek. It was my pleasure to be on Dr. Talks.
Dear listeners, please share and spread awareness about healthy eating during COVID 19 by sharing this podcast with your friends and family. Cheers till we meet next time.